Today my presentation is on Down syndrome. Down syndrome is a condition that has lifelong implications along a diverse spectrum. It has long been depicted in the arts, stretching back as far as 1500 BC. In 1866, J. Langdon Down, an English physician, was credited with identifying Down syndrome. Mr. Down has a very controversial background associated with his discovery of Down syndrome. It began with his concept of the physical features of individuals with Down syndrome resembling Mongols, and so Mongolian imbecility was born from his perception of how they looked in 1866. This characterization of a population was used to associate Down syndrome individuals with the lower racial hierarchy of races during that time. The working theory that these individuals were all the evidence needed of a regression of mongrels to a more pre modern state of races held court for several decades. However, this view expressed would not hold up in this era. What is Down syndrome? Down syndrome is considered a universal birth defect, with the main cause being the abnormality of chromosome 21. This syndrome is globally the most common and prevalent genetic disease in newborns. Down syndrome is the leading intellectual disability throughout the world and generally is accompanied by heart defects, among other health issues. Trisomy 21 results in three copies of a chromosome. The trisomy of chromosome 21 is the cause of Down syndrome. This is the most common type of Down syndrome. However, there are two types that are lesser known: translocation Down syndrome and mosaic Down syndrome. Down syndrome has several different clinical features that show themselves as symptoms, starting with cranial facial dysmorphism. Neck and limb abnormalities are just as common as craniofacial abnormalities. Several things come to mind with craniofacial dysmorphism. You can notice slanted eyes, skull deformities, flat nasal bridges, flat facial features, and brushfield spots, which are spots on the iris of the eyes. Neck and limb abnormalities tend to show itself as a short neck or short and broad hands. The ears also appear dysplastic, folded, and small on the sides of your head. How is Down syndrome diagnosed? Prenatal testing has become the most important testing in the diagnosis of Down syndrome. Medical technology allows us to find out whether or not a child carries the chromosome 21 before birth and allows parents to make those decisions based on all the facts. Typically, a blood sample and ultrasound is conducted within the first few weeks of pregnancy. Other diagnostic methods include conducting an amniocentesis, CVS, chorionic villus sampling, karyotyping, and RAD. Individuals with Down syndrome suffer from a variety of long term implications. Congenital heart defects or cardio-malformations are at the top of the list. One of the most frequent heart conditions in individuals with Down syndrome is AVSD. This defect happens when the heart development is incomplete. Typically, the heart valve in the center neglects to separate the other valves. Individuals with Down syndrome also struggle with PDA. This is the result of an unclosed heart in the aorta. This hole doesn't allow proper blood flow to the lungs and instead misses or skips flows into the lungs and deprive oxygen to the lungs because the hole should be closed. They also suffer from thyroid dysfunction. Hypothyroidism can occur from up to 8% of that population. Thyroid glands can malfunction and create side effects that consist of weight changes, sluggish behavior, delayed cognitive function, and testiness. Your body regulates its use of energy and hormones via the thyroid gland. Down syndrome individuals also suffer from digestive system abnormalities. The biggest one seems to be Hirschsprung disease, which is an inherited condition that presents itself at birth in mostly males. It also causes issues with getting rid of stool due to the lack of ganglion cells that stimulate the muscles of the colon. There are also three more digestive abnormalities that seem to be found within Down syndrome individuals. The age of symptom onset for individuals with Down syndrome is anywhere between 13 to 16 weeks of pregnancy. Individuals with Down syndrome have some options for treatment and long term therapies. One of these treatments involves self care. Self care is a crucial factor in providing physical and mental health development long term. Physical exercise is also a key component of self care. Obviously, exercise enhances your body's ability to grow and develop in areas of strength, cardiovascular development, weight loss, and just general body movements. Hygiene and grooming are also an important part of self care. Special ed programs are also needed. Being a part of special education programs allow individuals with Down syndrome to achieve higher levels of self-care and self-awareness needed to progress in their life and their community. Special education aides can be a vital influence that can help shape and mold their mental capacities. Support groups are essential in creating an experience that can be shared amongst a group of individuals struggling to achieve a specific goal or cope with being unable to achieve those goals. Speech therapy is also a vital part of therapies needed for individuals with Down syndrome. This therapy supports their cognitive and social development from birth to adulthood. Their ability to learn as many words as possible only enhances their ability to process language into actions. Occupational therapy is used throughout the span of life for individuals with Down syndrome. These health professionals provide a mentorship for individuals with Down syndrome to help with their everyday life activities. Individuals with Down syndrome suffer from low muscle strength, which is why physical therapy is vital for movement. All of these therapies provide a support that not only is necessary, but is needed for the long term success of Down syndrome individuals. That concludes my presentation. I hope you've enjoyed.